Hi, Eric. Thanks for coming in today. Nice to meet you.
Thank you. Thank you for having me.
Are you comfortable there?
Yes, I am. Thank you.
Would you like a glass of water?
No, thank you.
Okay, great. So today we've got 3 interview questions that we're going to be going through.
Sure.
If you could just give me your answers on each of those. So we'll start with the first question if you're ready.
Sure.
Considering the NMBA standards for practice that govern your nursing practice, how will you deal with the following situation? It is your first rotation as a new graduate nurse in the cardiac unit. You responded to a patient call. When entering the room, one of your patients is short of breath and another patient who is diabetic was feeling lightheaded and sweating profusely. How would you handle this situation?
Okay, so being that there's 2 things happening at once, the first thing that occurs to me is to call for help. So I'll be pressing the call assist button so I can get some assistance from another nurse. Next, I'll be assessing the most immediate risk and thinking of the A to G assessment. The person who is shortness of breath will be my priority. So I will ask that patient to sit in the bed, place them in the high phallus position. While I'm doing that, I'll be asking the other patient to remain seated while the other nurse comes for help. Once the patient is sitting in the high phallus position, I'll be obtaining the information I need to see if the patient's airway is patent, and I'll ask them a question. If they can respond, then I'll know that their airway is patent. And also I'll ask them to open up their mouth and make sure I have a quick look inside, make sure there's no obstructions. And I'll be listening for anything, any indications of that. Next, I'll be applying nasal prawns, 2 liters of oxygen. And then I will be obtaining the oxygen saturation levels using the oximetry pulse reader, oxygen saturation probe to check the oxygen saturation rate. If they're still short of breath, I'll be recalling the handover and looking at their notes and checking their medication chart and see if they have any PRM medications such as salbutamol. And I'll be administering that salbutamol and monitoring their oxygen saturation levels to make sure that they come back to a stable within the flags of the SAGO chart range. Once that is done, I'll ask the nurse that comes in to help the next patient with a low blood sugar to obtain a blood sugar reading using a blood glucose level monitor. And once if the blood sugar level is really high, then I'll be doing ketone levels on that patient. If it's too low, then I will see if they can tolerate some something to help to bring that sugar level back up to normal. If the patient can't tolerate any food, then I will be administering medications depending on what the medication that patient has charted as prescribed to bring them back to normal blood glucose level. And then I'll be monitoring to see awaiting the effects of giving that medication or that treatment. Next thing I'll be doing is escalating. So I'll be escalating to the nurse in charge, the 2 situations. And then I'll be assessing and seeing if these patients need to be clinically reviewed, or it needs to be a MET call needs to be called, a rapid MET call needs to be called as well. And I'll be informing the other staff members by documenting and verbally handing over.
Excellent. Thank you. Thank you very much for that comprehensive answer. So if you're ready, we'll just go on to question number 2.
Sure.
Okay, so nurses must comply with work health and safety standards. Describe a conflict situation you have been involved in your undergraduate nursing practice or as a nursing student. What did you do? What was the outcome? And what would you have done differently? So let's perhaps begin with what did you do?
Okay, so working as a student nurse, I'll pick that one. One time working as a student nurse, I was working under an RN, and she had quite a heavy patient load and quite a lot of nursing priorities to attend to. And I remember sitting in a room with a patient who was double amputee from below the knees. And this patient, I recall having to be two people to transfer her from the wheelchair to the bed. And there was buzzers going off, and the experienced nurse, she said to me, well, you look like a capable male, you should be able to transfer this patient on your own. And then she walked away. So I recall that this patient was meant to be for two transfer from looking at the patient's notes. So I just asked the patient to remain in their wheelchair, and gave her a buzzer to press if she needed us, and let her know that I was going to return with the other nurse and we were going to transfer her together. So I then approached politely, I approached the RN, and I said to her, I understand that you're busy, but can we maybe attend to your priorities, and then we can come back and transfer that patient together, as that patient is meant to be two people assisting for transferring, so I won't be able to do it alone. So then what we did was we gave some medications. You had to give some PRN medications, and she had to also reassure some patients that were asking for PRN medication. And so we dealt with that. And she also had some IV fluids running. So she did those things. And then we came back to the original patient, and we transferred her together. And once that was done, then the conflict was resolved.
Excellent. And so the last part of the question was, what would you have done differently, if anything?
What I've done differently? Well, always keep in mind that when people are busy, experienced nurses, they can be anxious too. They're human too, and I'll just always make sure that I help them to make sure that they can attend to their priorities. And if I need to, if the conflict were to get, if I felt like I couldn't handle that conflict with that nurse alone, then I know I can go to an in-charge nurse and also report it to them. And if I can't handle it with the in-charge nurse, then I know I can go to another manager that's up from that. I don't fear to do that. I have not had to do that yet, but and I hope I never do. But yeah, if I had to, I would. But I always try to resolve that conflict with that nurse that I'm working with at that time.
Thank you. Excellent.
Sure.
And this is our final question. So the completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a time of lifelong learning and autonomy. After obtaining employment, what is your short term, so within the next 6 to 12 months, and long term, within 2 to 5 years, career plan and your commitment to professional development? So let's start with your short-term career goal.
So my short-term career goal, me personally, I'd like to go and secure a new grad position at the forensic hospital at Long Bay Prison. So once I secure that and get that experience as a new grad there, then that will be my short goal plan.
Great, thank you. And so in terms of your longer term career goal, so 2 to 5 years, what would you say that is?
Say up to 2 to 5 years. I'd like to make sure that I get a wide range of experience within mental health psychiatric setting. So I would love to work in an acute setting, high dependency setting, subacute and rehab styles of mental health in hospitals, in the prison system, in the correctional system. that would be a good thing for me to experience, and that's what I would really like to do.
Great, thank you. And finally, in terms of professional development, what would you say is your commitment to professional development, or how would you continue to ensure that you are developing professionally as a nurse?
Sure. So while working in the hospital settings, there's mandatory training requirements that need to be done, which I'll definitely be doing. I can also keep up to date with the current nursing practice through e-learning, HEDI, also through my own personal education pursuits of looking at YouTube channels like Khan Academy, and also seeking education through experienced nurses, working alongside of experienced nurses, such as clinical supervisors. You know, in case of, in which happens in all careers, like being new and all, if you feel like you did something wrong or you could have done something better, you can approach these clinical supervisors and get their experience and knowledge, and they can guide you in the right directions of how to do things clinically sound with their experience. And just working alongside of experienced nurses and watching their practice, and sometimes you can, you know, get a lot from an experienced nurse, watching the way they do things.
Excellent. Well, thank you so much for coming in today, Erik, and thank you for those comprehensive answers. So the next steps is that we will review all of the applicants that we have, and we will be in touch with you shortly. Thank you.
Thank you so much. You have a good day. Bye now.